Hello, everyone. This is my first summit, and I'm just totally inspired. I am inspired by what I hear, but more so, I'm inspired by what I see here today. Thank you all for being committed to student success, as demonstrated by your attendance and, more importantly, your participation in supporting mental health. The voices that we heard just reflected on this video reflect the reason of our work and project the bright future ahead for our state and our communities. It's my honor to introduce our next panel, moderated by our Trellis Foundation Board member, Susanne Walsh. As you can see from Susanne's bio, she serves as president of Bennett College, a women's college, and HBCU in Greensboro, North Carolina. She's a former deputy director for post-secondary education at the Bill and Melinda Gates Foundation and has worked in philanthropy and for the greater good throughout her entire career. But more than that, Susanne is a connector. It is fitting that she is moderating our panel of higher education leaders today because she is a connector of people, ideas, and opportunities. The conversation represents 3 of the institutions participating in the mental health and well-being initiative that Trellis Foundation is currently funding here in Texas. Each of these leaders is distinguished and recognized in their own right, but we especially appreciate their commitment to mental health and well-being as a part of the overall support that students need to be successful. There is additional information and details about them in the program, but I'm happy to briefly introduce them this morning. Chancellor Mike Flores joins us from Alamo College District in San Antonio. Currently serving over 27,000 students, 72,000 students, excuse me for my dyslexia. The Alamo College has demonstrated a deep commitment to their region and to meeting student basic needs across their 5 campuses. Retired Lieutenant General and President Ronnie Hawkins leads Angelo State University, serving more than 11,000 students and offering more than 100 programs of study. President Hawkins' tenure is marked by a values-driven approach to higher education informed by his experience in the U.S. Air Force and a proud graduate of Angelo State himself. And finally, Chancellor Brenda Hellyer has led San Jacinto College District since 2009, serving more than 30,000 students across 5 campuses in the Gulf Coast region of Texas. Under her leadership, SanJac has become an exemplary institution for its design of student-centered pathways that lead to credentials of value. Please join me in welcoming President Walsh, Chancellor Flores, President Hawkins, and Chancellor Hellyer. Thank you.
Thank you. Well, hello.
Hello.
This is exciting. Why did you all laugh? Just because I said hello? Was it too much already? Oh, no. I am so excited about this conversation, and I think that Trellis, the work of Trellis, is nationally, just at the forefront, which means the 3 of you are at the forefront. And I want to start just by asking, what on earth were you thinking when you first applied for this opportunity? So I'll kind of go down the line and just, what convinced you to focus on mental health and well-being? I'll start with you.
Sure. I would say earlier it was about community context, right, and a community of care. And I think it is related to community context. So San Antonio has one of the highest urban poverty rates in the nation. We know that determinants of health and economic stability is really key So I think for all of us, understanding community context is the most important. And then being able to connect with Trellis, Jed, Meadows, and being able to ensure that we are strategic and purposeful is aligned with understanding our community.
So at San Jacinto College, through all the COVID, we were making Sanjac Cares calls. And this was faculty, staff, administrators, and they were reaching out and just calling students, checking on them. And I say just, we made about 47,000 calls. And it was just, how are you doing? What do you need? And it became so clear through those efforts, the struggle that our students were having. And then in 2021, we restructured all the student services areas, and we created a student support services dean position, and Tanisha Antoine's here, and so if I get anything wrong, you can ask Tanisha later. And then Robbie Murray's here, our director of mental health also, and so just know you can go to them afterwards. But we created that, and we were having a real struggle trying to hire people. We had committed that we were going to do things different. We had counselors, but they were counselors/advisors. And as we dug into it, about 70 to 80% of the work they were doing was really advising, and it wasn't counseling. And so we made the decision, we're gonna redesign this. We're gonna put these positions to be about 100% counseling. I think when I looked at the job description, I think it says 2% advising. And it was really focused on how do we make sure we provide the supports. And then we couldn't hire people. We really, as we had turnover in the area, we had people who wanted to go from their counseling advisory position just to advising. And so we're struggling here. What are we doing wrong? Where do we get support? And that Trellis, being able to apply for Trellis and get into that community of support. And I'll talk more about how we really redesigned how we recruited counselors. But it was critical for our team to be able to see what's happening. What do we need to be doing differently? The Healthy Mind Survey, that was part of it. We had to get data. We're an institution focused around data and making decisions on data. That Healthy Mind Survey has helped us really see where we need to target differently. But it has been a tremendous resource, this Trellis work, and the Jed Foundation has been amazing. So initially we knew we were struggling and we needed help as an institution in order to better help our students. And we've made significant progress, and that's because of this grant.
Do I call you Lieutenant General? Do I call you Lieutenant General?
President's fine, or
okay.
Ronnie's better.
I just wanted to check. I didn't know. Want to be?
I will just tell you, my wife calls me Ronnie, and so that's how I know what to respond to. But I will tell you, back in 2020, when I became the president, a lot of things during my military career also helped accentuate the focus that we have on it. And that was already going on before I became the president. But when we started our core values journey in February of 21, and we were right at the height, if you will, of everything going on with COVID, I recognized from the experience I had in the military that it wasn't just the students. We needed to look at our faculty and staff. And more importantly, the contagion statement that was made by the previous moderator was very, very near and dear to my heart. And so we wanted to make sure our faculty and staff were prepared, and they were, don't get me wrong, but we still needed to look at it. And as we started coming out of COVID and being able to collaborate with each other, I saw from the perspective of what was taking place with our student government, and then also our student athletes as well. We needed to focus in on mental health in a different way. The people, our professionals that are doing that right now, Dr. Ream, he's here right now, Dr. Drew Curtis is here as well. They already had a great model in place, but then it became something where it was a community, and that was part of our core values, and was community not just inside Angelo State, but it was outside. What our community partners outside, the mental health areas outside Angelo State, how they could help. And we can focus on that later, but that's how we started that.
I love that each of you, so there's this big debate about the value of higher education, and I like that you've each used the word values, and so I feel like we need to shift the conversation to what are the values in higher education, not the value of, but the values in higher education, because each of you is really coming at this work from a really deep place. None of you answered in a superficial way, and so I want to dive a little bit deeper into sort of what's been going on, what have you learned, because you took that big leap to say we're going to apply for this grant. And so I'm going to start with you, Dr. Flores, again. So we heard that Alamo College is your multi-campus district. You're covering a huge geographic region, which is part of what was really appealing, of course, to us. And so talk about how you can implement programs when you're not just focused on one place. I mean, you've got geographic, cultural diversity, probably all the things. How'd you do it? Give us, and I'm going to write all the notes.
All right. Well, great. Well, I'm just one of 5,600 folks, right? Backing up 73,000 students. And so I think that's what's key. Our board of trustees, our vice chair is here, Mr. Kingsbury. And then all of my colleagues from Alamo, from our advocacy centers, our personal counselors. Folks, I'm going to ask them to just raise their hands. Can you all raise your hands and stand? So, anything that we do at Alamo is a team sport, right? So I mentioned community context earlier, and I think as part of that also, our moonshot is key. So we look at who we serve, and our moonshot is because we have the highest intergenerational poverty rate in the United States. So we know that to be able to change that is for individuals to earn a credential. So the moonshot is ending intergenerational poverty in San Antonio through education and training. The first few things that the board and the organization did is really getting our house in order, ensuring that we paired caring professionals, academic advisors with students, and ensuring that there were pathways to graduation, being able to ensure that all credits counted and that we drove down time to degree. So that was one. So once that's done, then the other part is looking once again at determinants of health, right? Economic stability is key. We saw that less than half of graduating high school seniors, about 45%, were going to a college, anything in higher ed. And so we launched 5 years ago what we call Alamo Promise, which provides assistance and pays for all costs, and now through what we call Alamo Books Plus, all instructional materials for students. But the other part is what we call, right, basic needs, or others call basic needs supports. So it was being able to leverage 5 individually accredited colleges as an asset. So how do we hardwire that? And it really is the beginnings, right, Lisa Black? The beginnings of 2 centers in Godless and Gill, right? One at San Antonio College, and then the other at Palo Alto College, to learn from those 2 experiences and then to use a methodology that we have, which is called discovery, incubation, and then acceleration. So beta testing share centers or advocacy centers at those 2 colleges, and then being able to look at and talk with colleagues and students about what works. And then being able, as Vice Chair Kingsbury knows, then we're charged with bringing things to scale that work. So right before COVID started, the board approved in that fiscal year to go from 2 advocacy centers to 5 advocacy centers, to be able to bring to scale case management and to institutionalize, actually before HERF dollars, emergency aid, work with the food bank, and do all of these things. So I think it is being able to look at promising practices at 1 or 2 sites, and then being able to socialize that information. The other part is really looking then at working with key partners like Trellis, right? Looking at survey data, Healthy Minds, and CESI, conducting a landscape analysis. What are promising practices amongst higher ed institutions within the United States or community-based organizations? You know, folks probably get these emails from vendors or from others, and so we would get these emails from Hanover. Who knows what Hanover is? Yeah. So we actually, thank you, Dr. Rayleigh, right? We actually engaged them at scale. So we worked with Hanover early on to do a landscape analysis of mental health supports, and then we were able, that was a resource along with survey data, and then also localizing that with feedback from practitioners and from students. So that would be the process, right? Engaging one side or two, talking with colleagues and talking with students, and then being able to glean feedback from statewide key partners and then national partners to be able to improve practice.
Well, and I think the way that you talk about how to get to scale is so interesting, because I think a lot of times when people talk about scale, it sounds like, oh, we have to start already district-wide. And I like that you're like, well, we're going to try some things. We're going to rapidly prototype in a couple of different places before we start to scale. And I think that's an important lesson. So President Hawkins, as we then think about, I like that you're bringing lessons from your military life. You're bringing all kinds of lessons into this work. And you talked about going from thinking, yes, about students, but you also talked about faculty and staff. And so I wanted to ask you a little bit about how you've structured this, because it's unique. You've structured this in a way, your work in a way where you're focused on mental health being led by an academic department.
That's correct.
What? I mean, that is really unusual. And so talk a little bit about how does that work, and then how do you make sure that there are connections? Because as we started to hear about, there are all these other people on campus who care about students too. How do you make the connections between the academic side and the counselors and the advisors? But first start with, what are you doing over there with the academic side leading this?
Well, I will tell you, Dr. Drew Curtis and the folks that he works with over on the academic side are great collaborators. And more importantly, when you get back to that core value of community, that extends horizontally across the entire university. And so then when you start looking at what our Vice President for Student Affairs, Dr. Ben Lyon, is doing to bring all of that together in a collaborative manner, indicators come up. And when we start seeing students have an indicator towards mental health or such, there is an alarm that goes across the campus to the senior leaders that we also look at using. Conversely, I sit and look at indicators and warnings. We have the police department on our campus, and so, hello.
Hello. And that's an alarm.
That was an alarm. But we have those types of indicators that I also look at what is going on behind the police reports, and I do that on a monthly basis. But in so doing, we're also recognizing situations that are happening inside the campus, inside the residence halls that I grew up calling dorms, but we will move that forward now, and inside those residence halls. And then we also look at where the GPA's at, how are people doing with their GPA? And so we have an early alert system that professors are also able to indicate that we have a student that is not, if you will, working in a way and manner that we would expect them to work. And then when you bring all of those things together, it's across the campus, and we're always talking about it during the president's meeting that I have with the vice presidents. We're looking at those types of things. But then it goes back again to how is the staff and the faculty, I don't want to call it behaving, but what are those indications that go on? My military career has shown us that there are periods of time in a year that you really have to look at things going on. And so one of them happens to be midterms. Yep. One of them happens to be Thanksgiving. Another one happens to be all of those holidays that students, even myself, you get homesick. And so those things are going on. But then again, we recognize that we have 7 different generations on our campus, from the professors all the way down to students in dual credit. And you've got to appreciate people don't think, act, feel, and react the same way all of the time. So when you pull that together in what Dr. Curtis and his folks are doing in the academic side, bring it forward to what we're doing across the student activity side, and then what our community is able to do with us, because we will send a student downtown, if you will, for if it would be a mental health related situation that requires that level of help. But those indicators go off so everybody knows about it.
And I love that you're all continuously looking at data. We're going to come back to data because each one of you has mentioned that, but having that through line with your faculty and your other VPs to make sure that you're staying connected is just incredible. And so, okay, Dr. Hellyer, what is happening? So at San Jac, because as you thought about this work, you prioritized additional staffing. Right. Who can take on additional staff right now? I mean, amazing. And so talk about some of the particular challenges that have been involved with that, because you started to talk a little bit earlier about like, oh, we had to find them first. Yeah. So you found them. And what are some of the challenges that they've had to overcome?
Let me talk about how we found them, because that took us quite a while.
That's amazing.
And you know, in higher education, probably in most companies, we all want people with experience, right? And so that's what we were out recruiting. We were wanting people who had higher education, counseling background, 4 years, and even though we're in a very large job market in Houston, all we were doing was recycling from institution to institution. Mm-hmm. And we weren't getting the pools that we needed, or that we really needed to make sure we were making an impact. And so we have a talent development acquisition person who leads all of our recruiting efforts. He met with the team. What do we need to do different in these job postings? And we have made it now where we're going to train internally. Mm-hmm. So we're going with 1 year of experience, not just in higher education counseling, but in broader counseling. Preferred if you have it in higher ed or education, but that's not going to stop you from getting into where we can have the interviews. And also, we used to go for licensed professional counselors. We've made that as a preferred option. Again, trying to get in good quality people. We worked with universities, making sure our postings were coming out when they were closer to graduation, so that was a hotter area for us to recruit from. And that has helped us get full staffing. And then really that focus of that internal professional development and making sure how we're structuring that development for those new counselors coming in. So and that's continuous. But you know, you need to make sure they have FERPA training. They need to make sure how they're getting into understanding what's happening in the classrooms. And then the other focus has been going out and meeting with the faculty and the staff. Faculty have been very clear that they need supports. They don't know what to do necessarily when they're seeing symptoms in the classroom or that they're seeing students. They needed to know where to go with that. And so we've made it very clear around what referral programs are out there. I brought this little card. This is a little business card, and it's got different QR codes for if somebody needs to schedule an appointment, about mental health assessments, what to expect in a counseling session, but even just the referral system so that faculty and staff knew how to put in the referral system and making sure that there was continuous follow-up. And so those have been the real key components. Bringing in interns. We've brought in interns from our college partners, also our university partners, to make sure that we've got, again, additional capacity. We do everything across the entire college because we want that consistency of services. And so that has been really important to make sure that we have that consistent training across all of the college. The other thing that the counselors are doing and the structure that we've put together is expanding those options with community organizations. We can't do everything, and so there are flyers that have exactly who you can reach out to from a community standpoint, and then creating those referral systems within our entity. The other thing is working with our ISD partners, our school district partners, because that's where we were hearing also. I mean, we've got 22% of our enrollment being dual credit students. And so making sure that alignment between our services and the school district services, but really building that culture. We have values, collaboration, sense of community. That's what this is all about. How do we make sure we're making this as a real priority across the institution? As far as budget, anytime we go into looking at how we're going to add people, it is, and when we're going out after a grant, they're not haphazard. They are based on, we know this is a priority for the institution, and then we start doing the modeling. This is what we're taking on. This is the 5-year model of where these projects or these initiatives are going to go, and how we're going to build them into our institutional budget. The other priority around this is making sure your board's aware. You know, making sure your board's understanding the priority of your institution, what you're seeing, and how you're responding to that in the community, so that the board isn't surprised when we're putting these additional resources in. And so we've made it very clear. The board has strategic retreats where we really dig into these kind of details so that it's, again, broadly across the institution.
So, was there any pushback at all to adding these new positions?
So we go through a prioritization process, but there was not any resistance. We have gotten funding, so another thing we added in this area was neurodiversity, and so we've added a director there.
Nice.
We've had private dollars to come in to support that. We made it very clear. Mark had talked earlier about braiding resources. We used COVID dollars first. We've got private resources, but we've also got it built into the next model of the budget. There was no pushback. Again, it's very clear where the needs are, and so how are you going to look at the resources? I was telling a group last night, our CFO, it's not a compliant CFO, and I know many of you have compliant CFOs. Our CFO is considered a business advisor. When your people tell you your CFO is a business advisor, you know you've made progress. And that is where she's helping us figure out how are we going to fund this? Where do we need to get creative? And so there is just a continuous focus on this is a priority. We're funding what our strategic plan is. This is it. And so we're going to figure it out.
So I'm wondering if this is the first time, and I'm coming to Dr. Flores, is this the first time in your career that you've, as a president or chancellor, where you've been able to say, I'm adding positions, we need more funding, and there wasn't pushback? Because, you know, when you say I'm going to add a position, that's kind of controversial. To look and see, they're snickering.
Well, I will tell you that we have a quarterly budget review where all of the deans, all of the department chairs, all of the vice presidents have to defend their own budget. And we prioritize across the university what we're going to do. So there's two reviews before we had that kind of discussion. And it was interesting to see how when it came to where we focused that on, the deans and the department chairs said that's the number one priority there as well. But when you're, again, collaborating and out in the open so everybody can see versus they think this is just being made in a smoke-filled room, it's a lot different. I will also add that we've got a doctorate in PsyD that also extends into what we're doing inside the community and how it is that we are able to work with them and reach down into the ISDs as well. To develop that type of force development, if you will, that is very, very important to us. And then that also extends to how it is we're looking at mental health at the elementary, middle school, and high school level. So again, that community piece is not just at Angelo State University. It's in the city of San Angelo, and it's in Tom Green County for that matter, because we're also working to where our students now have telework to where, or telehealth, to where it is that they can go anywhere that's possible to receive the right care that they need.
Well, and I think this, I love this idea of being able to access anywhere. And I know this is something that you've been working on, Dr. Flores, as well. And so accessing services anywhere, there are costs associated to all of this.
Right.
And clearly I feel this very painfully. And so, but what I think is so interesting is, again, like, so we've heard from two people, not controversial. This is the right place.
Oh, I didn't say it wasn't controversial.
Okay. Well, we'll come back to that.
I was going to
yes.
say, I think as demonstrated, right, leadership commitment is key at your institution. So this is one of our top 5 commitments at Alamo, right? So is being able to ensure that we provide supports to our students when they're most in need. And the commitment and support from the board. So being able to scale up, I would say now, upon reflection, we probably spend as much time talking about advocacy work and support for our students as we do about academic advising, and definitely more than any of the other conversations that we have at Alamo, whether it is overarching amongst the presidents and our vice chancellors, or whether it is at the college. And I think that is both leadership as part of the arc, right, of our moonshot, but I think it's also organic conversations that are happening peer-to-peer and partner with student, which is being able to both institutionalize and invest in those costs, and then being able to partner with others to do that. So United Way for us, and Lisa Black wrote the initial grant to United Way. Actually, we have a United Way helpline that provides support for all 72,000 of our students. We discovered that we were, through our United Way campaigns, actually providing over $300,000 in direct support to United Way. We were receiving just a portion of that back to directly impact our students. So now it's about $250,000 annual investment that our students can access and get referrals directly. Could be partnering with the food bank, in which we jointly fund benefits navigators at each one of our colleges, because we want to provide emergency short-term food assistance, but we want to be able to provide support to the student and their families on a monthly basis. So what does that look like? And then how can we move beyond that, actually, to provide healthy foodstuffs, right? Through community-supported agriculture, through college gardens on our campuses. So what does that continuum look like? And then how do we bring that to scale? We're serving the same individuals on our campuses that many community-based organizations are serving in the community. So why can't we do that together? And I think that's what's been key to support at all of our advocacy centers within Alamo.
And I love this term, advocacy center. So that's not a term that everybody has on their campus. Tell us, like, why did you choose that language?
I think higher education is about discovering your voice, right? It's about faculty and staff partnering with students that they discover they have agency. And so as part of that, then why not advocacy? Because the intent is that our students will be able to catapult themselves, right? Either catapult themselves into the middle class or affirm their ground in the middle class. And that's why we're here. So advocacy, I think, is just impactful, it's powerful for our students, for them to discover their voice and their agency.
Well, and I think that the terminology is so critical too when you think about this topic of mental health and well-being, because that creates a very different vibe to talk about advocacy versus counseling, or, there are lots of other terms that are all important, but this actually gives it a different kind of a spin. And so I'm going to come back, because President Hawkins, you said that it wasn't controversial. I need to know about the controversy. What was controversial about saying this is where we're going to invest our time and our resources?
Well, the big controversy came in that people not really realizing how little dollars you really do receive from the state, if you will, and how you have to go out and start looking at other areas to gain those types of resources, read funding. And then when you see how it is it's allocated across the university, they gain an appreciation for what it takes for us to get all of the jobs done. And so when there's a high point and a high priority such as mental health, but you're only funding it, if you will, at a 20 or 30%, and you just look around the room at everybody and say, okay, which way do you want to go? That's when those ideas start becoming where it is that everybody focuses on the normalization of going towards the mental health. And when I said it was a controversy, it's more about just an underappreciation and not having a lot of knowledge and transparency in how our money is being spent. We now do that there at Angelo State University.
Well, and so what's next? What's next at Angelo State University?
Yeah, well, that advocacy word is one of the things that we're using right now. We have a lot of students with disabilities that need help, and we want to set up, we already have a freshman college and a dean of a freshman college, but we want to set up a center for success student success at Angelo State. And more importantly, that we want that to be, again, over in the academic side of how we do things. So we're looking at how we make that a reality at ASU and moving forward and how we incorporate mental health as one of the primary focused areas that we have in that advocacy center.
So as we're hearing, you each have these, your work is organized in very different ways with each of your institutions. And yet the thing that drives each of you is data. Like I tried to keep listing out all the many, many sources that you've all listed. So there's the Healthy Minds survey. Do all three of you use it? Has everybody used it? You use your CESI data.
I do.
Anybody else use their CESI data for this kind of work? Oh, okay, talk to Dr. Flores and his team afterwards. And then there are a number of other various surveys, and the video right before us was about student voices. Data can be boring. How do you make sure that it's not just something that you're interested in at your cabinet level, but that everybody gets excited and interested in all this data that you're collecting? Because the three of you are very excited. You're using it. But what do you do to make sure that others are using it? And back to your transparency point, does everybody have access to the results? Do faculty, staff? You look like you had a thought, Dr. Flores.
Sure. I would connect the prompt that was offered in the video about what would you tell your president?
Yes. I didn't pay attention to that.
And the young lady responded. I think that if you look at survey data, it tells a story. And so, one of the things is looking at our data both in personal counseling, right? So my understanding from our outcomes, right, Gil, is that we've seen both an increase in students, 25% increase in students, but an 83% increase in sessions. That gives me pause, right? It tells that's a lot.
Yeah.
So although we've added more personal counselors, obviously then there's a need as we get ready in June to propose to the board increased staffing, then that would be something to really look at is instead of being at a one personal counselor to 3,000 student ratio, then maybe that needs to be increased again, right? Because that would be the part. And then my colleagues met last night, I understand, over dinner and already did an informal assessment of what the needs are for next year. So then that would be the other part, right, is being able to socialize the data. But it's really conversations like this. It's engagements like this in which folks have downtime, to be able to meet together informally and then discuss those needs and for us to connect back to that and reflect upon what that looks like for our students.
So you mentioned that you're going to take something to the board, surprise. Oh, no. But also, can you talk about, and then you're all going to get sort of the same series of questions, but talk about, is there any policy state policy that needs to be influenced? Can you use your data to help maybe shake up some things at the state level? What do you need from the state?
So with Representative Howard here right up front, right? So, and just want to thank you for your advocacy and support of higher ed and what's critical. Well, I think House Bill 8, right, really did a lot for community colleges within the state, and Chancellor Hellyer knows that. very intently. But for us, the weighting students that are economically or academically disadvantaged, and then adults 25 years plus. So if we had the legacy formula within the state, Alamo would have just received net new $5 million more in state funds. Now that it's performance-based, this past fiscal year, we went from $5 million to $25 million more. So that allowed us actually to scale up personal counselors from a 1 to 9,000 ratio to a 1 to 3,000. That allowed us to reinvest directly back into student supports, into more counselors, advisors, enrollment coaches to connect with students. So I think that's the key. Our rhythm is that we begin in the spring planning, because we're so big, to engage presidents, vice presidents, deans, and faculty in the discussion, and then to come to the board in the spring, but really in July, to present our budget for next fiscal year, so we can get that achieved. So it's no surprise, because Mr. Kingsbury actually helps lead and champion that process, and so we'll come forward with recommendations regarding advocacy work and increased enhancements to support our students directly.
And I want to thank Representative Howard also. I mean,
That's why we're here. We are here to thank you.
The House Bill 8 was huge. And the advocacy that was done across the entire higher education community, the community colleges, and then just all the support from the legislators. For San Jac, it was a 33% increase in our state funding. It was about $16 million. And that also allowed us to put the resources into these areas. But it also, we did a job evaluation study. We got a whole lot more competitive with wages. But it was all about how do we best support our students. And the data, you have to go back, and yeah, you can look at these numbers and you can look at student success data, but it's all about the student behind that. And so how do we dig into that data and understand the faces of it? And we have a Promise program for our for our high school graduates. Out of this May 2023 graduating class, we had over 3,000 of those Promise students. 78% of them are first generation to college. That is an astounding number. And that is much higher than what we had seen in the past with how we were reaching into our community. So we know now what are the additional supports we're going to need for those students, right? And so it's mental health, it's the tutoring, it's all these components. And so how do we start looking at that differently across our institution and having those conversations and making sure how we're planning to prioritize. And so when I look at what we're doing in the mental health side of it, or the whole student support areas, somebody will say, well, is that going to generate more funding through House Bill 8? You're not going to be able to pinpoint it, I don't think, necessarily. But it was what was heard in that earlier panel about persistence. If they're not getting those supports, they're not going to be persisting, and they're not going to be ultimately completing. And so there will be, I think, a real increase. It's going to be tough to try to correlate it. As far as policy around mental health at the state level, I don't have that figured out. I think there needs to be this very broad, it doesn't just start in higher education, right? It starts in public education. What are the supports that are needed there? What are the additional resources, and how does that go the entire continuum? And so that's really, I think, going to be our challenge as we move forward. Is this isn't just, will this sector take it? This is a very broad issue that has to be dealt with across our state, and the resources going into it, and how, again, that whole alignment. And so I think that's going to be our next big challenge, is how do we really address that?
I echo the sentiment with Representative Howard being here in the House Bill 8. but I would tell you the ask from the state would be different from me, and that is that we've got to stop having the universities and community colleges have an unfunded mandate for Hazelwood, Legacy Hazelwood specifically. It's a drain on the university to be able to do some of the things, mental health and otherwise, salaries and otherwise, to have to take tuition from students that have paid and pay the Hazelwood fee. And I think we've got to get that changed. And that's coming from a veteran, but I can tell you that that is a tough one. And I'm not saying do away with Hazelwood. I'm saying we've got to look at a different way that is funded.
Is there anything in our last 5 minutes, and when you think about all of the work that you've been doing, because this is amazing. I mean, if you think about all of the work that each of these institutions is doing, this is incredible work. And it really is leading edge, not just in the state, but nationally. And, but it's also really hard work. You heard Dr. Milliron earlier talking about, you know, that sort of toll, that emotional toll on those on the front lines. You're making difficult decisions about your budgets every day to support this as a priority. So with all of that and everything else that's happening, you know, what gives you hope in this moment, especially as you continue to be at that leading edge of mental health and well-being supports or advocacy for your students? Let's start with you.
Well, I will tell you the other exercise to close your eyes and then open them and see the student. I don't have to have them closed. I walk the mall all of the time, and when I walk it and see the students, I see my 3 children, I see my 6 grandchildren, and I see myself having walked that mall. And I see those students, and then I recognize the parents or grandparents or whoever is supporting them when they cross that stage of graduation. And that gives me hope to be able to help them. We have a motto at Angelo State: we're in business of changing family trees. And we want to do that in a positive way. And so I have hope that we're able to do that.
And I'm so grateful for commencement 2 times a year that we have, because you really can see the impact, and it's what you're saying. The May graduation, our youngest graduate's going to be 15, earning an associate degree. We'll have about 850 high school students earning their degree at the same time, as 2 weeks later they'll earn their high school diploma. But it's that oldest graduate who's 72 or 74, and that's been the age the last 4 or 5 years. And I do a pop quiz at commencement. They all moan, but it's an easy one. I have them stand up if they're first generation to college. And you see all these, I mean, it's about 80% of our students. And then I have them stand up if they worked while they were going to college, and if they've gotten a foundation scholarship. And then I have them stand up if they're there because they're to change the lives of their family. It's overwhelming. I got goosebumps just thinking about it right now. But it is that impact you see about the social and economic mobility that you're changing in your community, and that's what it's all about. That's the hope. And if we lose sight of that, then shouldn't be in these jobs anymore. And I really look at that as the work that's being done every day in our institutions. And so it's hard work, and it's, you know, we need to celebrate the successes, and we're trying to do that a lot more because our employees need to understand the work that they're doing and how it really is impacting lives. And so I hope that if there's anybody, you know, a legislator who wants to come out and visit and really see the impact, to come to one of our commencements, just to come and listen to the stories of our industry partners, because that's the incredible work that's being done by every one of our institutions. And so that's the hope.
I would just thank you, right? So I think one of the wonderful things is we don't have enough time to reflect and to talk. So to be able to gather here today, to hear from others, from colleagues, just to be able to meet over lunch or dinner, to plan informally and discuss what's going on each of our college campuses, and then to bring that back home, I think is really critical. Graduation is a celebration, so that's really nice to see each of the students as they cross the stage, and then they scan the audience, right? They're looking for their supporters. Where's mom and dad? Where are my kids? Do they see me cross the stage? I think we need to take advantage of those times to step back and reflect, whether as professionals here to have an informal dinner and talk about what does that look like for the next year for us, or whether we're on the stage or in the audience cheering on our students. Those are the key moments, and for our students, that's what really counts. And so just want to thank each of you for your support. Trellis, right, for the foundation for your support of our efforts, but most importantly, each of you here, because we don't have enough downtime to be able to disconnect and just have those informal conversations over dinner or over coffee. And that's what's really key that restores us to be able to continue what we do on a daily basis. So thank each of you, and thank you for bringing us together.
Oh my gosh, well, I mean, I have to still close out the panel, but I feel like you did it beautifully. But I think that the power of I love that you ended on the power of reflection, because I think that that's, again, what each of your institutions does really well, is you do pause, you look at the data, you think about it for individual students. You also scan your campuses, looking for those individual students and their families. And so as we think about sort of closing out this section, please continue to think about these inspirational leaders, their institutions, all of the work of their teams who are here, and think about how you can also pause, reflect, celebrate, and also struggle. Like, struggle through this together. That's part of what it means to be part of this Trellis group, is this learning community. You're struggling through it together, and you should be celebrating together as well. So thank you all so much for joining us, and thanks to all of you.